With the European reference networks, we are trying to fill the gaps in expertise in individual countries. So we have gathered the best experts in certain rare disease areas in a total of 24 reference networks, and they provide their expertise to anybody who needs it.
As physicians, we are there to treat patients, and the ERN is there to help us. If we have a difficult case, then the help is tomorrow. And then we can discuss a difficult case with the biggest experts you have in Europe.
The most positive things about ERN is that it allows reference centers from all countries to generate more knowledge, spread information, and generate research.
So the European Commission has developed a completely new ICT system that enables virtual consultation. It's called the Clinical Patient Management System, abbreviated CPMS. And CPMS enables to discuss patients from every healthcare provider within the European Union that is connected to an ERN. The system is completely ICT secured. It complies to all the GDPR rules, and logging in is only allowed for those that have been approved by the ERN coordinator themselves. The elegancy of this system is that it facilitates remote discussions, and for the majority of the consultations they can be performed via the system, so the patients do not have to physically travel. So this virtual consultations via CPMS can shorten the delay in diagnosis. They can expedite a more adequate treatment because these consultations are done in a multidisciplinary team.
The experts that are available for consultations are really outstanding clinicians who have a lot of expertise, and their advice is usually extremely helpful to the clinicians.
In Reconet, what we have done, thinking that CPGs were very important, is, for example, to try to understand what we have. We reviewed everything, and we realized, unfortunately, that for the majority of the diseases we follow, there were very few CPGs. We have something, but we do not have a lot, and we will have to work on what we don't have and try to develop new CPGs. We are working on this with patients and with the experts working within the network. I think that the involvement of patients has been amazing within Reconet. So what we are doing with CPGs now is to discuss with them about guidelines, whether they need to read physician guidelines to understand what's happening and why a physician is taking a decision. And this interaction with patients is continuous, and it's very important.
Education and training is particularly important for the management of rare disease. There are several levels of education that we are doing in ERN. The first level, but it is very important, it's really the multidisciplinary tumor boards, which are usually taking place every week in each ERN institution, where we bring people from outside. So they see how patients should be diagnosed and treated. A second way is, of course, to bring in physicians or young doctors in training within a reference centers of ERN, spending a few weeks, few days, few months to get research program and to ensure that the patients are being managed and treated according to the clinical practice guidelines. The third part, more formal, is webinars and training courses which are performed regularly and organized regularly within ERN. Webinars to get information on a specific topic, and more global courses which can take place over 2 to 3 days, where we cover each individual cancer classes of rare cancers.
In the European reference networks, we have a great setting to bring together some of the best researchers for these rare diseases, to perform studies, to perform lab work, but also clinical research and clinical trials on the diseases of interest. We have in place now a research exchange program for junior researchers from the labs that go from one place to the other, and that is supported by the European Commission and the member states through the European Joint Programme for Rare Disease Research. So in the process of establishing the ERNs, we found that it's extremely important to find out and know how many patients with which kind of rare diseases we are treating in these networks. So to have an overview. For that, it's extremely important to have databases where the diagnostic information of the patients are collected. We have set up now a number of registries. Every ERN will have an ERN-wide patient registry very soon, where we can obtain this information for our research.
Our focus is to be sure that the patient is always in the center of what we're doing, and that we always have a feedback from patients for what we are doing. ERN is there for patients and to treat patients. That's the reason why ERNs were developed.